All right, recording.
All right. Let's start this here. These props here. This your bed? Appreciate it. Wait for James to get back in here.
Still can't get a hold of her.
It's all right. All right, you ready to roll?
Yeah.
All right, thank you guys for being a part of this class today. My name is Nate Fry. I'm a fire specialist here at Sny Valley. And what we're gonna be going over today is some first aid provider, really focusing on doing some assessments and even going through some of our, just as basic as getting through body substance isolation, communicable diseases, and then we're gonna end with skills going over hooking up someone to a non-breather and then doing some one rescuer CPR. If you haven't been here before, we've got exits, 2 exits on this side, exit there. We also have bathrooms right through those doors over there, another set of bathrooms out there. Any questions at all so far? All right, we'll get into it. So here's our course objectives. We've got 10 objectives, I believe. So we're gonna go through, and the goal is at the end of this class, we'll be able to be proficient in this. We're gonna be able to describe the role of the fire service in providing EMS, explain patient confidentiality requirements, identify communicable diseases that first responders commonly encounter, explain ways to prevent the spread of communicable diseases during emergency medical care, explain the process of patient assessment, describe cardiopulmonary resuscitation, also known as CPR, and describe methods of controlling bleeding. Explain shock management, and then we're gonna go over these 2 skill sheets, which I'll just go ahead and hand out now. This is what we'll be getting tested on. So, there's 2 for you. Here's 2 for you as well. We'll hand out quizzes later. All right. Objective 1, describing the role of the fire service in providing emergency medical care. So here, especially at Sny Valley, many other places, get called an EMS call. We're gonna treat on scene and then most of the time transport the victim to a healthcare facility. So we've got different types of ambulance services. We got fire-based EMS, which is what we are here, obviously at Sny Valley. We have our own ambulances. If you go to Independence, they got third service EMS with AMR that contracts with Independence Fire. And then you even have hospital-based EMS, which out in Columbia is, you see more of that. I don't think we really have a whole lot of hospital-based EMS out here. So, ambulance service, we want to become familiar with equipment, protocols, and our standards of care. It's important to train regularly with EMS personnel and have a good working relationship. We are the EMS personnel, so we do both. What role does the fire department play in providing emergency medical care? Anybody answer that for me? Even specifically?
ALS,
here?
ALS care, like
Yeah.
respond to calls,
Yeah.
stop bleeding, shoot chest pain. Like,
Yep.
what that, I don't know how you want that answered.
Yeah. No, that's what I'm looking for right there.
Alright,
We do it
cool.
all. You guys see all right? What level of emergency medical care does the fire department provide in your jurisdiction?
ALS care.
ALS care, which we haven't even got to yet, but that's what we do. All right, on to the second objective. Explain patient confidentiality requirements. Has everybody heard of HIPAA?
Mm-hmm.
Who can tell me what HIPAA is?
Governing body, make sure you don't spill the beans on people's private information.
Yeah, we can't, if we're going to do an EMS call with someone, we have access to their medical information as far as that call, or maybe even their previous medical history. We can't share that with other people, right? So we're all familiar with HIPAA, law that regulates use, distribution, and storage of patient-protected medical information. Regulations dictate how and to whom patient medical information can be shared. We'll get into that a little bit more. So, we want to be discreet, only disclose patient medical information to those with a legitimate need. So, us, A shift, we run a medical call, we have that information. Do we need to go talk to B shift about it? No, it's actually a HIPAA violation. Release of PMI to others can only be done with patient consent. Become familiar with department and authority having jurisdiction guidelines. So if we were ever gonna share somebody's medical information with anybody else, we would actually need to get written permission that we can do that.
Technically, you can also do as long as you get a transfer of care, like I can relay all the info to like the nurse or doctor receiving the patient from us.
Right.
It doesn't violate.
Right. Who has the right to access patient medical information? Can anybody answer that question?
Just those on the call.
Those on the call, those that are actually giving medical
Whoever's
care.
part of the treatment, put it that way.
Right, and then whoever the patient gives the right to, right? All right, learning objective 3. Identify communicable diseases that first responders commonly encounter. Patients may have communicable diseases which are not always obvious. Identify signs and symptoms of communicable diseases, and then we want to use our body substance isolation, right? So we always want to use our gloves. Depending on type of call, we might even wear a mask, we might wear some glasses. All right, hepatitis. Hepatitis is a disease that inflames liver. Viral hepatitis is the most common one, and it can also be a result of years of using drugs, alcohol, hazardous chemicals, or even just hereditary. So there's 2 different types of hepatitis. We've got hepatitis A, hepatitis B. A is typically caused by consuming contaminated food or water. It can still be transmitted by close contact with infected individuals. And signs and symptoms of that are fatigue, abdominal pain, fever, dark urine, yellowing of skin or eyes. That would be something we might look for, some of those symptoms. Typically, no long-term consequences. It's the least serious form. But hepatitis B, on the other hand, it's typically transmitted through bodily fluids. Infections can be short-term or long-term. They can cause serious scarring and injury to the liver, and they can even progress to liver failure. Signs and symptoms resemble hepatitis A, serious, potentially lifelong infection. So, if someone's showing those symptoms and they don't know they have it, a lot of times, we come across patients and they'll tell us that they have hepatitis, if we're gonna get an IV or something like that, and we're gonna expose the blood, they'll tell us, hey, and we'll ask, do you have any, bloodborne diseases? And, they'll tell us, but if someone's showing these symptoms, they might not even know they have hepatitis, and so we wanna be extra careful. And then there's C and D as well. C is transmitted through bodily fluids. Individuals can go for many years without exhibiting symptoms. That's even more scary, which is why we still always wear our body substance isolation, because you just never know. If they don't know, then we definitely don't know. Liver damage can be long-term or permanent. Liver failure can occur. And then hepatitis D, uncommon strain, only occurs in individuals infected by hepatitis B, makes effects of hepatitis B much worse. Vaccines. There are vaccines that are available for hepatitis A and B. They're working on those still for C. Firefighters need to be immunized against hepatitis and other infectious diseases. Common sense, we want to thoroughly wash our hands and maintain proper BSI on all calls. Tuberculosis, this is another disease. It's a bacterial infection, primarily affects the respiratory system. It's airborne, so unlike hepatitis, which is through bodily fluids, tuberculosis is airborne and it is contagious. Spread when infected persons breathe, cough, or sneeze. Incidences are more prevalent in high-density living areas and considered active when individuals exhibit the signs and symptoms. So what are the signs and symptoms? Fever, fatigue, chills, weight loss, painful breathing, productive cough that lasts several weeks. Doesn't that sound like a lot of flu-type viruses? So it's hard to know, which is why we still just want to always take precautions, because we're coming across sick people all the time. We don't know if they got communicable diseases or not. Precautions, we're going to take our BSI. We'll use N95 masks, even if patient is not known to be infected. No widely used vaccine. People do annual skin tests to check for exposure. We should wear N95s. I know around the COVID time we wore them a lot on these type of calls, and then maybe we start getting a little bit more lax, but really only takes once, right? HIV, AIDS. So AIDS weakens the immune system to the point where the body is unable to fight off diseases. Early symptoms are similar to other viral illnesses, and then the advanced stages can lead to severe muscle wasting and increased likelihood of contracting other infections. Persons with HIV are likely to have diseases such as hepatitis and tuberculosis. And then how is that spread? It's spread through infected blood and bodily fluids. So the answer for all these, use our BSI, right? That's right. Less risk to responders than hepatitis and tuberculosis. Why do you think that is?
Because this one's exclusively fluid.
Yeah, exactly. And a lot of people know, not everybody, but a lot of people know if they have AIDS too. And I'm thankful a lot of our patients communicate that with us before we do blood draws. But yeah, important to practice proper BSI procedures and decontaminate equipment. Medical equipment and services should be decontaminated immediately following soiling to prevent spread of infectious diseases to responders and other patients. How do we do that here?
We wipe down the stretcher with disinfectant.
Yep.
And we throw everything else in the trash.
That's right. Sandy cloths. Multi-drug resistant organisms. Probably most popular one that we've all heard of is MRSA. Difficult to control, typically do not respond to conventional antibiotic treatments. That's what makes that scary. Staph infections, which is MRSA, common. See that a lot in the hospital settings and other healthcare facilities. usually initially seen as skin abscesses, and they spread easily. So again, what's the answer? Take proper BSI precautions and sanitize all reusable medical equipment. It's kind of all we can do, really, right? What are some other diseases? H1N1, swine flu, bird flu. I remember when I was in high school, those were real common. There's always something new. This slideshow is probably from before COVID. COVID's not on. Tests and treatments for communicable diseases. If exposed or possibly exposed, follow our standard operating procedures for testing or treatment. If we think we've been exposed at all, you're gonna tell your supervisor. Your supervisor's gonna make sure that you get tested while on shift. Immediately. So, what are 3 communicable diseases that first responders commonly encounter? Scott, can you give me one of them? Hepatitis.
A, B, and C.
A, B, and C.
TB.
Tuberculosis. AIDS. HIV, AIDS. Alright, on to the next objective. Explain ways to prevent the spread of communicable diseases during emergency medical care. I feel like we covered that pretty well already with body substance isolation, right? We'll see if there's anything really different than that. We're not required to be immunized against certain infectious diseases. Pathogens, organisms that carry disease and can cause infection. They exist in bodily fluids and infected persons and transmitted through contact with infected fluids. Bloodborne pathogens are most common, but airborne are also a threat. Obviously, exposure happens whenever how it's transmitted. You come in contact with that. So you got a tuberculosis patient, they're breathing in your face, exposure. You got, you have a HIV patient and the needle has blood on it, and you accidentally poke yourself, that's an exposure, that's a bad deal. So what are BSI procedures? Just to be clear, first, even before using gloves, we always wash our hands, right? Wash our hands before and after calls. We want to use our rubber gloves on calls. If we get toned out for something where it's especially during cold and flu season, like a respiratory, we probably want to wear a mask, maybe even put some goggles on if they're really coughing. Something that's not in here that we do is put a mask on the patient. You know, if they're really coughing, we'll put a mask on the patient. Everybody knows how to wash their hands. Gloves should always be worn during patient contact, latex or vinyl. Use non-latex gloves if the patient has a latex allergy.
Pretty much all gloves are non-latex nowadays.
Alright, this seems a little bit silly, but this is a good way to remove gloves without, if you're careless, you can get the outside, what's exposed on the glove, and get it onto your skin, right? So we want to go from the inside out, peel it out, and then just directly turn it inside out, directly into the trash can. Eye protection. This is only necessary when blood or bodily fluids can be splashed, sprayed, or spattered. Helmet shield is just glasses on steroids, pretty much. Covers your whole face. So there's definitely different types of masks going around. You know, when we first had the COVID scare, we had P100s, which a lot of other departments did not have. They filter out 100% of particulates. The most common one that we still have on the buses that we still use are N95s. That means they filter out 95% particulates. Gallons. Now I haven't used one of these. We had the Tyvek suits. I haven't used one of these since COVID, but really a very good tool. If to wear your P100 or your N95, glasses, and a Tyvek suit, and you're probably not getting anything, right? Can we do that on every call? No. But if, you know, we get that information dispatched, these are some of the signs and symptoms. If you remember from the slide, okay, that is signs and symptoms of some of these communicable diseases, then we need to wear some extra PPE. All right, cleaning these items. We want to use antibacterial spray. I will say one of the things that I've noticed when we do clean stuff, you know, we use the sandy cloths or even bleach, says kills 99.99% of everything. Well, one of the things it does say on there, depending on what we use, Mediquat was one of them, you're supposed to leave it for a few minutes before you wipe it off. Sometimes you see people spray, wipe off immediately. You're actually supposed to leave it for a few minutes before. And that's what we're gonna use. That's what kills pretty much 100% of these things. They just can't say 100%. If things get really bad, we can throw our bunker gear. We go to a call and we got bunker gear on for a communicable disease or something. We got our gear washers that are really good about
This is more be along the lines of like running a car wreck, you actually get someone like
blood.
Yeah,
Exactly.
blood.
Exactly. Anything with blood on it or, you know, bodily fluids, we're gonna put that in our biohazard bags, right? We got our red bio bags. We have the red sharp containers that are biohazard sharp containers. We don't put anything that's got bodily fluids or blood just in trash bags. We put them in the bio bags and they go in a separate bio container that we have a company come pick up all that stuff separately. It doesn't go in dumpsters. That's the way we keep everybody safe, including people that come and haul it off, right? All right, what procedures does the term body substance isolation refer to? Anything to keep yourself safe from disease, right? What types of PPE do responders typically use during EMS calls? Gloves, eye protection, maybe an N95 mask.
Mag suits, gowns, OB, body isolates, kits.
Yeah.
We got a lot of stuff.
Yeah. We are on to learning objective 5 out of 10. About halfway through. We got any questions so far? Everything making pretty good sense? Cool. Everybody feel good? Temperature good in here? Everybody need to use restroom? Okay. All right.
You're about 10 minutes before you use the bathroom.
Okay, sounds good. Yeah, we can take a break for 10 minutes. All right, explain the process of patient assessment. Come up onto a patient, right? We can tell pretty quick, sick, not sick. Are they responsive, unresponsive? So if it's a responsive patient, as you know, as far as even being able to, you can tell someone's responsive. Are they looking at you? Are they talking to you? Unresponsive, they're out cold, look like they're sleeping, and they're not even responding to pain, right? If it's a responsive patient, we're gonna start with airway, breathing, and circulation. If it's unresponsive, we're gonna go circulation, airway, breathing. Any ideas? We're gonna get into it. Any ideas why we would do that?
See the heart's pumping, the heart's not
Yeah,
pumping.
'cause if they're not-
One in airway.
If they're not responsive, we wanna make sure first they got a pulse, right? All right, pulse is present. Assess airway and follow normal ABC sequence. If the pulse is not found, we're gonna immediately begin chest compressions, and we're gonna open the airway and ventilate the patient. Airway. If the tongue or foreign object fluid obstructs the airway, air can obviously not travel freely into the lungs. If a patient appears to talk and appears to be breathing without difficulty, assume the airway is clear, right? If they can talk, they're breathing. If patient is unresponsive, the airway may need to be open. So obviously they're not talking, but what's behind there, you know, they could have vomitus, they could have choked, you know, there could be a foreign object in there, or just their tongue could be in the way. They're snoring real bad. All right, so when we assess breathing, we're going to come up to them, place our ear near the patient's nose to listen for sounds. We're also just gonna look at chest rise. Is their chest moving? Is their belly moving? We're gonna look at the mouth and chest to see if chest is rising and falling. And we're gonna provide assistance if the patient is not breathing or if no air moves during breathing. Because if we assess that, we get to that point and they're not breathing, but they have a pulse, soon they're not gonna have a pulse unless we start breathing for them, right? Circulation. So we're gonna check for a crowded pulse. It's the easiest way to determine if someone has a pulse. Something you're gonna see in there when we do our practical test, our skills test, is we're gonna feel, but we're not gonna feel for more than 10 seconds, all right? If you don't feel anything for 10 seconds, then they probably don't have a pulse. We're gonna assume they don't have a pulse. But sometimes in the heat of the moment, we'll get going so fast that we only feel for 2 seconds. And then we just assume they don't have a pulse, but they do. Radial artery, that's down here. It takes stronger blood flow for a pulse to be felt than at the carotid. Just because a pulse cannot be found at the radial does not mean the patient is pulseless. If patient's blood pressure is below 100, they might not have a radial pulse, but they'll have a carotid.
Say that again?
If a patient's blood pressure is real low, they might not have a radial pulse, but they will have a carotid. That's why if someone's unresponsive, we check for the carotid pulse, not a radial.
Correctly.
Yeah. What do the ABCs of patient assessment refer to?
Airway, breathing, circulation.
Beautiful. All right, on to 6. Describe cardiopulmonary resuscitation. That's CPR. So, clinical death and cardiac arrest. That's when the heart stops beating. There's no breathing. Heart fails to circulate blood throughout the body, and the cells are not able to receive oxygen and nutrients, and they're going to begin to die as well. Can result from a problem with the heart's ability to produce and or transmit electrical impulses. I mean, it can be caused by all sorts of things, right? So biological death is when the cell death progresses to the point that organs such as the brain and heart are irreversibly damaged and cannot be revived. So we do CPR before we get to this point. Defibrillation. So that's what this AED is right here. So it's critical to perform defibrillation as early as possible. Advanced EMS may take several minutes to arrive on scene. Heart's condition may not warrant defibrillation, or defibrillation may not resume heart's function. But the AED is going to tell you that. It's going to take shock advised, shock will rhythm, or not. And we're going to get into that skill of setting that up here in a little bit. So cardiopulmonary resuscitation, composed of 2 parts. It's the cardiopulmonary. So the cardio part is you're physically forcing blood through the body by manually pumping the heart.